So we are going to go over how to use and maintain your new equipment. So what I like to do is start from the base of the chair and work our way up to the delivery system, up to the light, just so we basically do it in like a stacking motion so we don't start bouncing around on everything. So first thing I like to show, you have to have the compressor on when you come in the morning. You'll come in and you'll lift up the master toggle on the side of the delivery system. You'll hear it start pressurizing, and once it gets enough pressure to it, you'll see the screen turn on. If you come in and the screen doesn't turn on, but you hear the air from the compressor, first thing to check is this button right here. You can see we changed that design a number of years back to make that master electric switch more inset into the sub base. So it'd be kind of hard to hit that switch, but it can happen. Maybe somebody's in here cleaning, they're cleaning really good on the sub base and accidentally hit that. So if I hit that button and it releases out, you see what the touchpad does. The lights turn off on the touchpad. What it basically is doing is it cuts off the electrical power to the delivery system. So that's the first thing to always check. If you come in, lift that switch up, hear the air coming in, but the screen's not turning on, check that main power button. Coming around to the back lift arm of the chair, there's a safety plate up underneath the chair. So you can see how this moves. If I come in and I hit the down button here, you can see the chair stop plate was activated. You're going to see that signal on there. It's not going to let you lower the chair. It's basically a safety feature. Whether something's tucked up underneath there, you don't want it to come down maybe on the foot pedal, or if you're not paying attention, you're just standing here talking, you press the down button, it's not going to come down and smash your foot. It's going to hit that and stop and pop up a little bit. So if you see that come up, you know it's the safety plate underneath here. What you'd want to do is hit the up button. Basically raise that up and get out whatever is trapped underneath there. In the back here, you've got a brake release. If you want to swivel the chair left or right, it's just this safety, not safety, this brake release here in the back. So you pull it to the right. When you're ready to lock it back into place, you don't have to push it way over. You just push it till you feel tension on it, and it locks it back in. Nice thing with that, if you'd have a patient in the chair, you pull that over, it's still very easy. Even with a patient in the chair, it's like there's nobody in the chair. The way the chair is designed, it's very simple to position left or right if you need to. You get to the armrest design, you can see you've got armrests. The armrests are designed the same way on the right and left. For entry exit, it's nice to have this swung forward. We'll put the chair down into where it's positioned right now for entry exit. Which is way too low. So when our chairs come out, they're always factory set. So for all of your chairs, what I would recommend, and I'll show you how to change these positions, is you want to come in and raise the chair up a little bit. So just by pressing that up button, bring it back up a little bit. You want it at a height that, I always say a good way to position this to get it close to an easy entry exit where it makes it easy for a patient to get in and out, is when you get your stool set, roll your stool around, take the height of this and try to get it about where your stool is. Usually when you got your stool position, your hips are a little bit above your knees. It's easy to sit down into the stool and step out. We want the same process here for a patient. So if I'm coming in, I want them easy to just sit into the chair and not have to fall down into it and not have to push up out of it. Obviously there's different heights of everybody, but I think trying to get that happy medium in there. For me, I can turn and step easily out of this. I think this is a height that most everybody in here could, so it's a good average height to start at. Reason you want to swing this forward is when you come in, you don't want the patient having to come and get into the chair way up here. Chances are they get in way up here, they're going to come, they're just going to lay in the chair like this. Their hips aren't going to be pushed all the way back. They're going to lay back here. You're going to lay them back. You can see my shoulders are not above the backrest that high, so it's not going to give you full articulation of the headrest. I have to ask them, can you scoot up in the chair for me? Versus having it forward, it's where you can have them sit into the chair, turn, scoot their hips all the way back, and I would have this just raise it up for them really quickly. So at this point, they're seated all the way back, and I'll show you something we can do with the headrest here in a minute, but you want the patient all the way back in the chair when they come in. And that's going to lead into some of the stuff with ergonomics we're going to talk about in a little bit. Have the armrest back. These are really, I don't know, we call them armrests, but they're more of like a hand rest. The way the chair back's designed, you can see here, this is going to give me support for my arms when I lay back. You can see the way it flexes. And you'll find a lot of patients just cross their hands when they're laying back. But if they want something to hold on to, this is where their hands are going to go. So again, when you're done with the patient, you sit them back up to get them out of the chair. You don't want them having to push up. So you can see the way our seat pan is contoured, and that's for comfort. If it was flat, you'd feel more pressure on the back of your legs. So if my legs are coming over, it alleviates some pressure on the back of my legs, also the top of my legs. But they would have to scoot up this and step out. Then you're getting out too, where you could possibly slip on the sub base. Maybe there's some cleaner on there, you can slip on it. But here, when you're finished with the patient, just get in the habit of pushing this forward. Tell them just to turn in the seat and step out. Nice thing with both of these being able to go forward is you can see you can accommodate any size patient. A lot of the chairs on the market have a way to either maybe slide an armrest back, position it out, drop it down, but they're all attached to the backrest. So you can get them out of the way, but you're still going to have the mounts for the armrest somewhere here. With this, you can get them both completely out of the way, accommodate any size patient. And that does come into a nice thing to have every once in a while. But you get that, I turn in the chair, step right out, and I would just leave that down until the next patient comes. So going around the chair, we've got the light arm. We'll look at the water bottle now. With the water bottle, like we were talking about earlier, you'll want to turn the unit off. It's a 2-liter water bottle, so it holds a good amount of water. If you forget which way to turn it, which you'll get used to this, is the more you do it, it's going to be clockwise to turn it off or take it off, counterclockwise to put it back on. So when you come in to take it off, it even shows you here. First step, start pushing up on it. You release and it comes off. It's about a quarter turn. What she's showing up underneath there on the video, there's 2 metal brackets on the mount. And if you look on the water bottle here, there's 2 tracks on either side. When I go to put this back on, you're going to turn counterclockwise. So you can see if these were the 2 metal brackets, they're going to hit. It's going to raise up and settle back down. So you can't over tighten. If you leave it loose, you're going to feel it loose. You're going to hear the air. But the nice thing here too, you've got the pickup tube is integrated in the bottles. You're not worrying about trying to not touch that. Taking the bottle around it. With this design too, it's not a standard threaded design, so you can't cross thread it, you can't over tighten it, you can't under tighten it. These things are built really durable too. So if we're gonna go back and put it back on, get up underneath it, I engage it and I start turning counterclockwise. It grabbed right there. You can see how it naturally starts going up. When it turned, then it's going to seat down. So easy as that is. Once you get used to that, you're gonna be able to do it with one hand. You're gonna come in, take it off, put it on. One quick thing I'll show them there too. If it ever starts getting hard to take on and off, you'll want to put silicone. There's a main black O-ring under there. Almost any time you're like, man, that thing's starting to get hard to take off, you get some silicone lubricant, put it on that O-ring. I guarantee it's going to make it easy to take this on and off again. Now, O-rings are recommended to be replaced. Like I said, I'll get you that sheet on our recommendations for maintenance items like that. But the silicone, these are little packs of it right here. We also have them in a tube we can send out, and it'll last you a long, long time. But really important to lubricate all the O-rings. So we'll turn the unit back on. With what I'll mention, since we just went over the water bottle, is anytime you replace the water, say the water is low, you fill the water bottle back up, you're going to want to drop a tablet. It's our ICX tablet. You drop it in the water and it dissolves. So you do this anytime you fill the water bottle. Helps to keep biofilm from forming in the water lines, keeps the water smelling good, makes it just an easy way to maintain your water in your delivery system and bottle.
I have a question. So you said every time you fill it up?
Yep.
What if it's halfway? Like, if it's halfway, do you recommend waiting till it's all the way low and then refilling it? So it's one tablet per bottle?
One tablet per bottle.
So you really need to not fill it up until it's down to the bottom, so that ratio will be correct.
I would recommend if you get it and you got like a quarter bottle of water left and you're getting ready to do a procedure and you know you're going to probably use more than that, I would go ahead and go dump that water out.
Just dump
that's
it.
in there
Okay.
and start over again. Good question. Okay, so we'll work our way up to the delivery system now. And see if I try to lift this up or push down, it's not going up and down. You've got air brakes on here to raise it up. When I let off of that, it locks it into place. I want to lower it. You got an air brake on both sides. You don't have to do both of them. You just press, lift up, let off. On the side of the unit, like we showed earlier, you've got your master toggle. If I push that down, it's going to turn the unit off. Lift it up, that's when you're going to hear the air start pressuring in. Right across here, now this is where you start to get a little confusion sometimes. It's like, if I need to increase the water to a handpiece, which one do I use? The easiest way to think about it, I'm going to turn it around out here now, is if I go left to right. Say if I wanted to increase the water on this first handpiece position. Always think left to right. I'm going to go left to right over here. The ones that are all in line are your water adjustments. So for that first handpiece position, the furthest left one is going to be right here, obviously. To increase the volume, and it shows it here on the dial, it's counterclockwise to up the volume. Then obviously counterclockwise, going backwards. Counterclockwise to increase, clockwise to lower it. The dial that's offset right here is your air coolant. So if you're running a handpiece that's going to have water going through it, you put your hand next to the handpiece, you're going to feel air coming out. That's your adjustment for that. So you're always going to need coolant air turned on to get a mist of water. If you ever pick up a handpiece that's going to have water running through it, you run it and it's just a stream of water coming out, there's no mist, that's the first thing you're going to want to check. You're going to want to make sure is turn this counterclockwise to get some coolant air coming out. And then these you just adjust to where you want them.
So if I'm setting up a slow speed handpiece, let's say, and we would like it to be set up right here, or or a straight handpiece, then we would make sure that this first one here is completely tightened, closed, righty-tighty, correct? To make sure there's no water coming out.
Yeah, if you know that you're going to leave this handpiece position just for a low speed or a straight, what we can do is we can just turn this down to where it stops. And this is one of the things I was about to bring up, is you never want to take these and crank them down really tight. Over time, that will mess up the block. It's a brass block in here. We use brass because it's non-corrosive, but it's a soft material. So if you take that, really crank that water control down over and over, it can start opening up that block to where you cannot turn the water all the way off. If there's a handpiece position that you're going to want to use water sometimes and then sometimes not use it, don't use these to turn the water off. Use these to adjust how much water you want while you're using it. If you want to turn the water off, always go to the foot pedal. That toggle, if you click it over to blue, you're going to have water activated to that handpiece position unless you have the dial turned all the way down. So I would get in the habit, if you're going to have overlap on one of the handpiece positions, use this to turn it on and off. It's what it's there for. And inevitably, somebody's going to come in there and start cranking out. I got to make sure that water's all the way off. I'm going to crank it all the way down, which you don't have to. But I think it's just, you're trying to make sure it's all the way off. Use the foot pedal instead to do that. Make sense? What we could do too, if you know you're not going to ever have a position on here that you're going to want water to run through it, we could turn that off, pull it out, you can put this in a drawer somewhere. So nobody's going to ever mess with it. We do have some offices, not very often, we'll see it in clinics sometimes where there's some overlap. They'll get the water positions set, they'll pull them out and put them in a drawer so nobody comes in and messes with them. It's not rocket science using this, but it's just getting used to knowing, when am I going to adjust the water, when am I going to turn it off, if I'm going to do it on both for a certain handpiece position. I don't want to get in the habit of turning it off using this all the time. That's what that simple toggle is there for. It's going to be a time saver too. If you're running and say for whatever reason you're going to cut with a high-speed handpiece, but you want to cut dry for a little bit, it's much better to use this. And then when you go back to the wet, just click it over, and then that water intensity is set to where you already want it. You're not turning that back up, getting it where you want to. So it just makes it easier to work with the water settings on there. On the back of the unit, this little piece we pull out here, this has got an exhaust tubing that's coming from each of these handpiece positions. So when you take handpieces to sterilization, you're lubricating them, they're going through a sterilizer. If there's any excess oil or moisture inside the handpiece, you put it on here and you run it, that's going to get pulled out through that exhaust tubing. So each one of these has a red exhaust tubing that's coming and connecting back to here, and it gets caught in here. So if you're maintaining your handpieces properly, if you have a handpiece maintenance system that's putting the right amount of oil but then also purging out the excess oil, you shouldn't have to replace this very often. But I would check it just maybe once a week, and if this is getting really wet or it looks yellow, then you know that it's getting excess oil getting pushed into there. It's a good thing to go back and say, hey, is our handpiece maintenance system working properly? Because there is basically maintenance you have on handpiece maintenance systems too. They have O-rings, they have timers on them. There's certain things that might be getting too much oil, it's not purging it long enough. So it can let you know ahead of time, it's like, we need to make sure our handpiece maintenance system's working right. But easy thing to check. If this gets like it needs to be replaced, all this is a folded up 2x2. Take it out, fold another one, put it back in. You just come back and pop this on. Simple. This right here is a purge button. If I want to take, and this would only be for handpiece positions where you actually have water running through them. You would take the handpiece off. You can take the coupler off as well. And you'll want to hold it over, say, a sink or have a little bucket of water you go through. Put it in there and you press and hold this down for about 20 seconds. It's just purging out any excess water in the unit. Don't see this done all the time, but you know, if you're going away for maybe Christmas break or, you know, vacation time, it could be good. Just go ahead and purge those water lines, or you can put it inside of your protocol as well. Just an easy way to flush out any excess water in the lines. So getting over to the control pad, turn this around so y'all can have this in our studio director coming out.
Sorry. Sorry.
So the way our control pad is now, it's been a design change since what you had prior. You don't have an actual button. We do on the assistant package, but up here it's more like how you use your cell phone. It's not an active button that's engaging into a little active switch underneath. What this is, it's a capacitive touch. So you're going to go right to what you're doing and press, and it's going to activate that position. When you're changing a preset position for the chair, there's not a program button on here anymore. Remember, you'd have to move the chair into the position you want. You hit a program button, then hit the position you want it to be set in. Now you're going to get the chair to where you want it, and you're going to press the position you want that programmed into. So right here, we set this for entry exit earlier. So if I want that position set in this first one, I'm going to press and hold. And now that's set in there. And you can see how that position lights up blue. So you know that's where it's set. And then you just go down the line here. Whatever position you're in, this one that's up on the top is showing essentially about where the chair is positioned. As you go over, if you're going to lay the patient back flat, what I'll normally do is set up these control pads. Number one for entry exit, or furthest to the left entry exit as you go over. That would be a starting position for working in the upper arch. Lay the patient back flat, which in hygiene is what you can probably use a lot. You're going to lay the patient back flat. So this would be set dependent on how you have your stool set and how low you need the chair to go. But it's simple. You can hit that, and then you can manually adjust by the up and down buttons. This up and down is going to be the base up and down. The arrows over here are going to be your backrest, back and up. When you get it where you want it, then you're just going to press and hold that second position. And it's going to be preset for your starting, say, maxillary position. So when you come in, you hit that button, you know where it's going to go. And then a lot of times you're going to have to manually adjust off that a little bit, depending on the patient. So we'll see where that one's set out right now. You can see that illuminates blue because that's where it's preset. I want you to notice the light. So you can see the light turned on by itself. So when you hit any preset position minus the entry exit, when you're done, you're gonna hit that light's gonna turn off for you. So when I hit that, it got back into its position, the light turned on. Now if I wanted to, say if this is what you had set, every day you come in and hit that, but you have to manually adjust off of that. So say, okay, I got the patient, I'm gonna raise them up a little bit. I gotta get back in that posterior upper a little bit better. Okay, I got them right where I want to. So you manually adjust that a couple times, but if for whatever reason you need to set the patient up for a little bit. Say if they just needed to sit up, they're dizzy, have a break, or if you needed to leave the room for anything and you didn't want to leave the patient sitting back, that's what this button all the way to the right is for, where you see an arrow going forward and backwards. If I hit that, it's going to turn the light off. It's going to set the patient up to relax, or if you needed to run to do something, You're not just having them lay back with a light in their face. You come back in, ready to work again. If I hit that button again, it's gonna go right back to the position it was just in. So in private practice, doctors, hygienists, they love this because unfortunately sometimes you have to leave the room during a procedure. The doctor's work and ask the assistant for a certain item. Oh, I don't have it here, doctor, I'll be right back. So they gotta get ungloved, run the central sterilization, come back, and so the doctor's like, I'm just gonna sit you up for a little bit, we'll take a quick break. Or sometimes doctors say, I wanna take another quick x-ray shot. Set the patient up, but they're not having to come back and get them preset again, right back to where they had them. So you think of the time savings here. Because hitting that and then you're moving them up a little bit, down a little bit, and it's not right where it was last time, but this is just a way to do that quickly. So it's just a nice time savings. Keeps you from having to get that patient position again. So that was that last one. If we wanted to come in and say, for any reason you wanted a position where it's going to set the patient up a little bit higher, backrest wise, and you're just going to be focused on maybe cleaning the lower arch. Again, thinking how can I get the best direct vision from a good seated position. Usually what we'll do is we'll take this base down, bring this backrest up. So again, thinking when I'm in my stool, this naturally brings the patient up. Their chin's going to stay down. When they open, you're going to be looking more directly into that lower arch. When I have them laid back, like we did prior, that's going to really lean them back. We lift the chin up, then you're going to have nice vision into the upper, and vice versa. You're going to be able to clean all the lingual surfaces. But just think about, okay, if I'm working in a certain part of the mouth, what's going to make it easier while I'm seated to have that direct vision? So like I said, a lot of the studies, and this has been going on for 30, 40 years, the highest prevalence of pain in dentistry is hygienists. Because you are working throughout the whole mouth and trying to move around and get situated, you're sliding your stool around. So always think, is there a way that I can position the chair to make it to where I'm going to be able to work with good posture? So when I'm going around here, so naturally, if the patient just comes and sits here and opens their mouth, and I'm sitting with good posture like I should, if they open, where am I going to be looking right into? Right into their lower arch. And if I'm wanting to look at more of the upper, you see they're going to lay them back more flat. I'm going to raise this up some. And again, when we talked about why we have a thin backrest, it's so I can sit upright with good posture. I don't have to open my knees. I can keep them together, slide right up underneath the chair. And you can see how close I am to where the patient's head will be. Now I'm not having to do this, lean over to see in the upper. I can get up closer, and that's where we take this headrest, drop down. This is supporting where the neck pivots. This is supporting the back of the head. I guarantee I could take any of you, lay you in this chair, leave it flat like we usually see. I'm going to come around working the up. Can you lift your chin up for me? You're going to lay here and lift up your chin. You're going to feel that tension in the back of your neck. Versus me not asking the patient to do anything. I take this, drop it down. It's doing that for you. But this is giving you that support where your neck pivots. You can tell the patient before they come in, this is going to be like a neck pillow for you. And you compare that with your chin up to that, just feeling relaxed. As a patient, this will be so much more comfortable for you. And then it's just going to be great vision for you while you're working. So for me, this is about where I would have it set. Again, I can change that really quickly, so that first preset for the upper arch is set. So when you get the patient laid back, you saw how the light comes on for you. There's a couple different ways to adjust the intensity on here. You wanted to do it off the touchpad. Turn this around for you. So on the screen here, we had our presets, we have our manual chair positions. If you go down here, there is a little button that looks like a clock. We'll go through that in a minute. The next button looks like a little light head. It's right there. So if I touch that, it's going to bring up, you can see the different light intensities that pop up. So if you look up here, this is letting you know what intensity you're on right now. You have low, medium, which is illuminated, high, and then your cure safe mode for your composite setting. Here you've got, again, left to right, you've got your low setting, medium, which it's on medium right now, your high setting, and your composite setting. To change that intensity, I'm just going to go hit the button I want it to be on. I want it on high, it just clicked up to high. The assistant side also has the ability to do this as well. If I want to go to that cure safe setting, I hit that. You see it turns the white lights off. And it goes with 4 yellow filtered lights. I'll have you come look at this again real quick. So cure safe, back to a standard setting. So you have your 8 white LEDs. If you have a material that you're using that you don't want to harden or cure, but you still need light, it's a great time to use that composite setting. Notice all the white lights turn off, which have the blue light in them, goes to 4 yellow filtered. You're going to have nice, bright light. It's just going to be yellow, but you're still going to be able to see good. So again, just toggle through these. You can also change the intensities back here. If I click down, it's going to lower it, and it just cycles through. I press down, so you can change it back here as well. You can also turn the light off from here. All you're going to do is press the button. That's the blue one. I'm going to hit that. It'll turn off. I'll turn it back on. Or if I'm sitting working and I don't want to reach over to the touchpad, there's a motion sensor up underneath here. If y'all can see it. Looks like a little dark. You probably can't see it from where you're sitting, but just get it on video. If I'm just sitting and I'm working on the patient, I just want to turn the light off really quick, but I don't want to reach over the touchpad. I put my hand up underneath it, it's got a sensor to turn that off. I can do it again and turn it back on. So again, when you're thinking about this, there's a lot of times you're not going to even have to touch the light. Once you get it positioned, so I'm working, I get the light positioned. Get it up over my head to minimize shadowing. So once I get this positioned, then it's simply adjusting the intensity off the touchpad, having the assistant do that from over here.
And the switch you turn for this side?
There is the same toggle switch up underneath here. You can see
Right
the
here?
little lever. Yep.
Okay.
So over here, there is a button on the touchpad over here as well. So from an assistant's perspective, the doctor's like, hey, can you take it off the composite setting now or go ready to go back to standard setting? They can give it a quick press. You can also press and hold. The same logo is over here. It's a different style touchpad, but it's the same light logo. I can press and hold to turn off. Quick press to turn on. So again, there's different ways depending on where you're positioned, where you're standing, if you're with an assistant, without an assistant, if you don't want to reach for the touchpad, simply turn it off here. There's a lot of different ways to do it, but it helps to minimize having to touch the light a lot. What works nice on this light is if you have covers that you put on your HVEs, live ejectors, you have the tip that goes in here, and you have the plastic cover that goes over those. Do y'all use those? Mm-hmm. It fits these handles almost perfectly. So instead of trying to get the tape, wrap it on here, and sometimes it pops off a little bit, it's coming unraveled, you can take those, slide them on, and when you're done, just pull them off. It fits these almost perfectly. There's also a light shield cover, disposable light shield cover. We used to have them, we don't sell them anymore, but the company that manufactures them for us, it's a company called Medicom. I don't know if they shipped with these. There were last few orders going out, we would send out 2 with each light. But it's almost looks like a screen protector you'd put on your phone. You peel it off and you stick it onto here. It's got tabs on each side. You place it, put it on, you can't even tell it's on. And you basically leave that on there until it starts looking dirty. So you could have it on there for weeks. But what it does is if somebody comes and wants to wipe this down, you're not going to get disinfected on the light lens, which can start discoloring it. Somebody comes in with a paper towel, they could scratch the lens. It's just a protectant to have on there, a lot like a screensaver on your phone. They work great. So easy way to take care of the light. So we'll go back to the touchpad really quickly. So we've got a couple more things to show on here. So if you go over to the lights and say you want to use this to get the light set where you want it to, but you're like, I want to get back over, I need to change my chair position. The one little logo right down here, if I hit that, it takes me back to my chair positions. So it's basically a little logo that looks like one of the ones for the preset positions up here. The little clock, if I hit that, you can come in and set up timers. If there is anything you'd want to time, I need a timer for a minute. I need a timer for 30 seconds. I need a timer for 2 minutes. These are preset to where they're at 1 minute, 3 minutes, 45 seconds, and then there's like a stopwatch. But you can go in and change these just like you do your chair positions. The way you go in and change it is there is a little dot down here. I'm going to hit that and it's going to illuminate. So if I wanted to, say, have a 30-second, I take that, go to 30 seconds. Now if I want to program that in for a setting, press and hold, and you've got that first button on there set up for a 30-second timer. So think you just go down, hit that dot, and it's basically, think of it as a cursor that goes onto the screen. These are going to illuminate to change. So if I wanted one for 45, well, I've got one for 45, so I'm going to do another one for a minute now. Now I want it in that second position. I got it to a minute. I'm going to press and hold. Now that's set up for a minute. Now to get out of this again, you can hit that, it takes it, now it's back into its set positions. If I wanted a timer for 45 seconds, I would just hit that timer. And it's going to do a countdown. You go back to work and it's going to basically beep when it hits the timer. You get back in my chair settings, I just hit the chair icon. The other button right here is something you're not going to use. That's if you had a cuspidor. And obviously we don't have cuspidor on the chairs, so you won't do anything with that. This takes you into settings There's really not anything you're gonna go in and do in the settings here. Technicians came and got everything set up. That's just going into, there's different things where you can say, I wanna lay the chair back, but I don't want the light to automatically turn on. There's stuff like that, you can go in and change those settings, and that's in that field. But what this does have on it is, it looks like a screen with a little lock next to it. If I hit that, this works for, say you're gonna wipe the screen down, or you're gonna barrier protect it. And if I came and took a barrier protector and pressed it on the screen, what's gonna happen? You're gonna probably hit a button, the chair's gonna move. So what this does is it's got timers on here. If I hit that 30-second, it locks the screen out for 30 seconds. To wipe it down or barrier protect, to where the chair is just inadvertently moved when you don't want it to. And that's down where you hit these 3 buttons here. So if I hit that, those 3 buttons, it's gonna take me to this, and it's that chair lock right there. It's gonna make you wanna come up and you're gonna be hitting that. It's the little soft key right below it that takes you into it. So right below that, there's your chair lockout, or touchpad lockout. Hit that again, then get back over to my chair icons. Any questions? Easy? So, again, we have our light on. You're finished with the patient. When I go hit the entry exit button, what's the light gonna do? Turn on. So I hit that, boom, lights off. And what else am I gonna do when the patient's sitting up and they're ready to leave? In the armrest, man. Yeah, love it. Glad I'm not putting y'all to sleep. So you got about 10 more minutes and we will be asleep. So again, just get in the habit of doing that. The other thing I want to have you get in the habit of, along with swinging the armrest forward, have you come sit in the chair for me? So again, we have the armrest down. What you'll want when you have a patient come in, say, okay, just sit in the chair, now scoot your hips all the way back. You'll bring this up for them. Now, a lot of times what we see when we walk through offices, the headrest is like this. So if you're not watching, a lot of times you'll have a patient, they'll come in and they'll slouch in the chair. It's like, well, that's where my head goes. So they're slouched in the chair. Or they sit up like this and their head just kind of floating in space. So say if the doctor's running behind, hygienist is running behind, it's gonna be maybe 5-10 minutes before they come in. Doctor has a nice view out the door. They have a monitor playing with, TV on it. She's sitting here and she really has nothing to place her head on. Might get uncomfortable. She might kind of lean back a little bit. She's like, man, where am I supposed to put my head? When you set a patient in the chair, a good thing to do is like, I'm going to sit you here. It might be a couple minutes before the doctor comes in, but I've got something to make you a little bit more comfortable. Bring the headrest out so you can bring your head back now. And it's just something to support you before they come in. It's better than this where they have nothing and she's leaning back, so that's not going to be comfortable. You bring it out, okay. Just ask them, is that comfortable? I say, yeah, keep take it back just a tad. Okay, bring it back just a tad. Do I need to lower a little bit? And when we talk to private practices, that's something, it's that extra step you're taking. You think dental offices, it's a competitive business. What are you doing to set yourself apart? Small things like this, patients remember that. They go to another office and it's like they're just kind of sitting around. Oh man, they brought a headrest out to me. It was so comfortable. The TV playing. It's these little things and it's so easy to do. But the other thing that does when you get used to doing that, it's getting you positioned to put the headrest at a good starting position before you lay the patient back. Another thing, I was talking to a doctor about this yesterday. She said she has some older patients that they get really nervous when the chair starts going back. Like they don't like to be laid back, so I'm trying to keep them up, from working in the upper arch, and they don't want the chair brought back. It's difficult. I said, do you bring the headrest out? She's like, no, we just have it back. And she said, I noticed when I lay the patient's back, they keep their head up, because they're like, and they're kind of holding their head up until they're laid all the way back, then they relax their head. So, you know, some people are not good with that movement up and down. They don't know how far it's gonna go back, how fast it's gonna be, is it gonna be a jerky stop? So what I told her to try to do is bring this headrest out. You lay your head back to where their head is supported while they're going back. I had a doctor bring this up to me one time. We were just talking about seating patients. He had some older patients who had that same issue. And he said, I noticed when I would bring this headrest out to them, their head was supported. They weren't holding their head, waiting for the chair to stop and then lay back. He said it made a world of difference. It was just that supported, like, okay, I'm supported going down. So I asked her to try that, but again, just something easy right here. Is that comfortable right there?
Mm-hmm.
You like it back a little bit, or a little bit better right there?
Mm-hmm.
And just talk with them, because it's a pinch. Drop it down, push it forward. It's really simple to do. You're not having to unlock a knob, move it, tighten it back up. So now, and it's a good way to, good rule of thumb is like, try to envision where her collar would be, the top of her collar. So it's gonna be up a little bit more. I can bring this out a tad. Just get it to where it's in a good, comfortable position and work with her on that. And then now when I lay her back, this headrest isn't gonna be flat. Her head's supported going down. And now when she gets back into that first seated position, she's in a close position to where I'm gonna articulate this headrest. If you're gonna be starting in the upper, say doing a cleaning there, the big thing you don't wanna do on a headrest is when you articulate, you don't wanna pinch and just lift straight up. That's gonna increase the gap from the bottom of the headrest to the top of the backrest. If I increase that distance in it, what does it do? It's just like pushing up the back of her head, and it's gonna feel like you can't move it, and it's not gonna be comfortable for the patient. So you want to keep this distance the same. So by pinching, if you're gonna lift, you're gonna wanna push in and up at the same time. Big thing is you wanna keep this, which is like a pillow, think of it as a pillow. You wanna keep that right where their neck pivots. Her head's supported in that pocket, but I wanna get her chin up a little bit. I wanna bring her head down. So just by pushing, bringing this down, is that comfortable right there? I'm keeping that headrest, or think pillow, right where it was, right where her neck pivots. You can see her chin came up. You can look left for me. Look right. You can see it's very easy for her to turn. It's a soft padding underneath here. She's got all this nice hair hanging over, which you wouldn't have to worry about me with that. But even you think about hair hanging over, headrest cover, what are you not doing? You're not having to turn a knob. So even with that, I can articulate up, I can drop down very easily. This is a fantastic headrest. There's not a headrest on the market that comes close to this. When you press this and move it, it's basically infinite movement. You're not moving through like little, like if I let go, is it gonna still have to settle into a little setting? Yeah, I push, and as soon as I get it to where I want to, as soon as I let go, I have the confidence I'll let go of this and it's off. It's locked into place. But again, it's really easy just to work with the patient. Say, is that good right there? I'm gonna put this just as like a pillow for you. We're just gonna get your chin lifted up. It's gonna be more comfortable for you. It's gonna be easier to open. So y'all, I'd say that's a big thing to practice. Have each of y'all lay in the chair, because again, it's pushing, you're gonna push forward and up. Just really focus on having this position where that neck pivots. Now, if I'm gonna do like most offices do, I'm gonna leave this flat. I can touch my fingers under her neck. So I'm gonna come around and say, okay, can you lift your chin for me? Her neck is so tight right now. So you're asking a patient to sit there with their chin up for an extended period of time. It gets very uncomfortable. So you think of her doing this, If you just leave it right there, versus me doing that, you can relax. And she's being supported now. It's no pressure on the back of her neck. Drop down. So she's not having to lift her chin at all. You're doing it for her. And I'm coming in now to where she's in a good position. She could look left, depending on what tooth surface you're working on. Great vision for you with good posture, comfort for the patient. It's really the best of both worlds. And it's so simple to do. I think it's one of the most underused things on a dental chair is the headrest. I think there's a lot of good reasons. You know, there are some headrests that are not easy to work with. You know, if you're having to turn it, okay, it's loose. Now I gotta, oh, did I tighten it enough? You just crank down on it. Then it starts getting hard to use. It gets cleaned. You know, the knob gets hard to turn. With this, I would say, again, this is something y'all practice on each other on this. I guarantee you, once you get used to doing it, as much as y'all are around a dental chair, as much as you have a patient, you would get, just becomes seamless to use. And it really is best for the operator and for the patient. So I've got her laid back, procedure's done. I'm gonna set her up, the light turns off for you. What are we gonna do here? I gave it away. So we're gonna swing this forward, she's gonna turn. Now if I lift this up, she's gonna have to push here, go up. Remember we talked seat pan goes up and down for patient comfort. She'd have to push up, swing around right here. It gets closer to the delivery system with her feet hitting here. But then you can also step on here. What if there was a cleaner on here that was slippery? You can have, especially an older patient, heel hits there and they fall back. So it just takes away having to push up and get away. You turn, and now it's just telling them to turn in the chair. Step right out. It's my co-star right there, thank you.
Could you, before you end the video, go over the clinician chair?
I was just gonna do.
Okay.
So remember we talked about, this is really where it all starts. Two places it starts are gonna be you being seated properly. I mean, when you go home and watch a movie at night, are you sitting in something that's uncomfortable where your knees are up above you, leaning over, it's just uncomfortable? You wanna be sitting in a comfortable position. So the first thing to look at is the height of the stool. So I'm gonna push this backrest is pushed up against me, so what you wanna start with is getting it to a proper height. So for me, this feels good about right here. And a good way to look at it is my hip, you know, about 5 degrees above my knee. If you're sitting like this, you're gonna get a lot of discomfort in the back of your legs are gonna fall asleep. A lot of times what we're seeing, the stool's low, and stools will go low a lot of times because you're trying to get up underneath the patient chair. And so it's creating a lot of pressure on the back of your leg. If you walk through offices, we'll see so often that hygienists will put their heel up on the back of the stool just to take pressure off the back of the leg. And a lot of times because they're sitting too low, their feet start falling asleep. You're trying to stay comfortable, you're sitting like this, trying to get under a chair. So first thing, just take your stool, lift it up. See that your hips are gradually above your knees. Second thing is you can tilt the seat pan here. So this first one's the height adjustment. This one right here does two things at once. So it brings the backrest to me, but it also tilts the seat pan. So it's a little, you know, when you work with this, if you've got the seat tilted like you want to, which I encourage you to tilt the seat a little bit, because tilting that seat is taking pressure off right here. Now, if I want to push this backrest back, if I lift up on this, I want to hold the seat in place. and I can push that backrest back some. If I lift this up, it's not locking into place. But you don't have to lift it all the way up to move it. If you just lift up to where you have the tension, you can push back. Say if you just want to sit back and talk with the patient for a little bit, and you have the backrest back to a comfortable position, but when you come back ready to work, you don't want to sit here and just push it up, you want to be sitting upright. When we talk to physical therapists, they always say when you start working, whether you're sitting working on a computer, whether you're in an assembly line, well, no matter what you're doing, but you take dentistry and you're sitting a lot, number one thing they say to do is get your spine straight. So you don't want to be back like this, you don't want to be arched over, you want to be sitting up. They say to try to stay in that first 5 to 10 degrees of movement. All your pain is going to start from your back. So as much as I can stay upright at that lumbar support, just like you see on my head, it's easy to see, you got this part sticks out more than where my spine is up here in my neck. It's the same thing in your upper back. Up in your upper back, the spine is coming out, but then as you get down towards your lumbar, it comes in. You really want to get that support in your lumbar. That's where the leaning forward, left, right, that's where you're putting all that pressure on all the smaller muscles. So that's why this one, you want this in the right height. So you get this, and once you adjust this height, you'll get it to where you want to. You just lock that in, and then I'm going to press forward, and you're going to watch the stool. So I was sitting back chatting with a patient. I'm coming in ready to work. You want to sit upright, think about my spine being straight. I'm going to lift this up, hold the seat, and that comes up to give me that support right there. You almost want to feel like it's pushing you a little bit forward. It's going to force you to sit upright. It's going to give you that support in your back. Then you come in and it's giving you that support. You got your tilt on here. You got your hips up above your knees. And when you get underneath the chair, because again, this is where we're going to start. You get this position, and then you're going to position your chair after you position the stool. So when you lay that patient back, you're going to want that first position you want that position to be where, number one, I can get underneath the chair. So this is too low for me. If I came in and I'm working, I'm going to be bringing, put this low so y'all can see. If I was bringing a handpiece in, think this is a handpiece. You have the patient's mouth here, my arms or my hands are going to be about right here. When you bring out your cell phone to shoot a text, are you texting down here? Are you texting like this? Guarantee most time, if you're not trying to hide a texter in a meeting or something, you're going to bring it up and it's going to be right here where it's natural. If you were threading a needle, if you're taking a quick note on something, it's just natural to have your elbows by your side and your hands at heart level. They have found that's where it takes the majority of the pressure off any of the tendons, ligaments, muscles in your arms, your body. It's just come into this natural position here. So for me, I would raise this up. Number one, about right here would be the patient's mouth. I'm coming in and my hands are at heart level. As much as possible, try to keep your elbows close to you and keep your knees together. If you're sitting there and you're sitting like this, you start feeling it's hard on your hips, it's hard on your lower back. So you don't have to do this because the chair back's so thin. Thicker chair, we're doing this so we're not doing that, but what are we also doing? We're leaning like this. So I can simply do this, get up to the right height for me. And instead of doing this and leaning, I'm putting my knees together and I'm sliding in. Then you're using the headrest. Instead of here to look in that upper arch. Y'all keep practicing this, you're gonna drop this down. Patient's gonna be really comfortable. Their chin's gonna be up. You have that light, and you're gonna have that nice direct vision. Buccal surface, upper right, lower right. have them turn, but you're also getting the lingual surface on the opposite side. And then the opposite. Look left. What can the patient do, and what can you do with the chair to get direct vision as much as possible? Obviously, you're going to have to use a mirror. You're encouraged to use a mirror, obviously, just to get that, that indirect vision. And then that comes in really good with utilizing the light in that position properly. All of this stuff works together for ergonomics. Your position, patient position, eye fatigue is so high in dentistry. You can ask Todd, you can ask Fernando. At the end of the day, we go talk to a dentist, they come out rubbing their eyes half the time. They look exhausted. They usually do their big procedures in the morning. By the end of the day, they're tired, back hurts, they have major eye fatigue. It's like 80% of dentists have eye fatigue, and hygienists. Think about it at the end of the day when you're going home and your eyes are tired, it makes everything's tired. So again, with that direct vision, good lighting, all of this stuff works together. And all of this is designed to make that happen. It's just using it properly. It's creating habits. I mean, it's so easy to lay a chair back and you're just used to pulling this out and going to work, and I'm just leaning. I mean, it's just part of being in pain with the industry I'm in. It doesn't have to be. Not that doing this is going to make everything super easy and being able to get up underneath the chair, but I guarantee you it's going to help you sit better, and it's going to make a difference over time. Because y'all just don't come in and do this real quick. It's the static posture. You're holding it, and then you're doing that patient after patient after patient. So really just think, when I'm sitting here, my hands where they should be, is my spine within that 5 to 10 degree range? Am I tilting my neck too much? And your head weighs an average of 10 pounds, but as you lean forward, it increases that weight as you lean forward. Like the specialists say, spine straight, try to keep your head as much over your spine as possible. I mean, if you lean forward like this, you can feel the pressure. You're doing that for a long period of time versus sitting upright. So just try to think of all this together. It's just creating those habits, getting used. I'm telling y'all, each of y'all get in the chair, work with the headrest. Get your stool positioned properly. Look at each other and be like, your stool looks a little bit low. Or when you're working, you're leaning over a lot. Do you even notice that? So it's really, really helping each other all the way around. But
I'm wondering if you could show us the dynamic between a dentist and a dental assistant, like the dental assistant chair.
yeah.
So if we could have
You want
a lovely
you-
volunteer?
Somebody want to can be the doctor? I'll show this from the assistant side first. and
Dr.
tell you all.
Magana,
Or Dr.
Josie? Okay. Just anybody. I just want to see what you recommend as far as adjusting the dental assisting chair and what it should be in relation, when they're working together, just to get your,
Yeah, I'll show you how we see most.
now you adjusted the height of this bar by turning that knob.
Yep. So this is the height adjustment.
Now, are there any notches like where this goes into like a little hole, or it's just really just bar?
This does. This, you can, it's like a tension adjustment. I can take that up.
So just a tension,
And
okay.
it's tightening it against that bar that's coming up. But we're usually going to keep this really low. I'll
Okay.
show you why. This, so you lock that in. Here, you can take this, it's just lifting up and it will pop into a little notch.
Okay.
I'll show what this is for. But then you have height adjustment.
Which is a little paddle, which is located right down here. That's height adjustment. Okay.
That's just like you have on your operator stool to get this up high.
Okay.
So first thing is we're going to get the doctor set properly. Because again, it all starts with the doctor getting seated properly. And the reason this stool sits up higher and also has a height adjustment is when I look over to Dr. Wilson, I want my eye level to be, at least 6 to 8 inches above hers. Because she's working, and what am I doing? I'm coming over, I'm making sure the mirror is clean, she's got good vision, I'm suctioning, but I'm also transferring instruments. So we're going to set the patient back. I'll show you this lower ring here. So when I get this set, it's important to get that lower ring set properly also. There's a little Allen adjustment on both sides. You want this to where you're sitting, you're just relaxing your heels on it. You don't want to sit like this. You don't want to have it up too high. You don't want to feel like you're reaching for something. It's there just to have that support. Again, just to take the pressure off the back of your legs and relax. So what I'll show you is how we normally see assistants working and how they're positioned. This usually comes around this way, and they're leaning like this. And if I'm sitting up above the doctor and I'm trying to see, so I'm coming in here, what am I hitting already? I'm hitting the patient's arm or the patient's shoulder. I'm trying to not do that. So what are you doing? Like maybe dropping a leg down? Because I feel if I'm leaning here and I'm trying to see, I feel like I'm going to fall forward. I have assistants saying all the time, I feel like I'm going to fall forward in my stool. It's because you're leaning way forward trying to see. So if we had the patient here, I'm coming in and trying not to hit their knee. I've got a cassette. Tighten that. I've got a cassette, I've got a tray, I've got all the instruments. I mean, 90% of what the doctor is using is coming from this side. Think of that, 90% of what the doctor is using is coming from over here. So if the assistant's not working efficiently, it's going to slow the doctor down. And why do we have a work surface that moves around? It's to accommodate if whether the doctor's working at 12 o'clock, 11 o'clock, where does the assistant need to be positioned? But it moves the instruments, moves the suction to where you're not having to reach and bend and grab. So if I'm coming in right here, first thing that's happening, I'm trying to not touch the patient, so I'm leaning way over. So what usually happens, you don't feel like you're gonna fall, is this gets lowered. So your feet are on the ground. So you don't feel like you're gonna fall forward. But you're still leaning over a lot, and it really inhibits your vision, because I'm like at your eye level now. So I'm coming in, you're holding your mirror, using your handpiece, you got your, your mirror in your left hand coming around. I'm trying to see that mirror, so I'm leaning like this. When the doctor needs something, what am I having to do?
Straighten up and turn.
I'll get that, doctor. I'm twisting. You're doing this class 5 movement. Assistants, they work in pain constantly too. Talked to a number of assistants who had to leave the industry. But you can see these movements they're doing. She's reaching back, she or he over here, and they're reaching back to grab the HVE. They got their syringe. Whether they're using their left, see a lot of assistants will use suction in the right, air water syringe in the left. And if I'm coming, I'm trying to look and see, keep that mirror clean. And the doctor needs something, it'll be, you usually want to put this together in a hand, but you're twisting back to grab and then coming back over. So when you look at, when I'm sitting in this position and having to lean just to see, and I'm low now, the way the stool is designed to be made is I'm gonna go from here, I'm gonna roll this back around. This is not a belly support. This is basically a torso support to support you leaning. It doesn't have to be all the way around here, because then you feel like it's getting in the way. If I take it all the way to here, I still get plenty of support. You can also rotate it back around if y'all are sitting and talking to the patient. But if I bring this over just to where it's right there on my hip, I'm gonna feel support here. And the reason you wanna feel that support is your knees shouldn't be going towards the patient. They should be going this way. And look at the gap this creates here. What is that, a good 12 inches? So if I come over, you should usually be about hip to bicep, hip to knee. And what does that also do? I'm facing everything. So I can move this, that's why this moves in and out. not only does it move out if need be, if you're coming around at 12 o'clock, I can pull this out towards me without it drifting towards the middle. We just need to tighten that bolt, so that's not going to drift like that. But like the previous ones you had on here, those were mounted up underneath the countertop. That was our previous design to this many years ago. You could swivel it over, but if you pulled it out, it naturally did this. It would gravitate towards the middle. So the way this is designed, I can pull it straight out and leave this open. See, look at the way this works. I mean, it's just a floating, it's a floating work surface. But it really adapts to how you're working. Again, we adapt the chair, the stool, to how the operator is going to work in good posture. This does the same for the assistant. Again, 85–90% of what the doctor's using is coming in from over here. So if I go from here to here, I can get in much closer. Now I'm up at the same height that I should be. I'm well above the doctor's eye level. Now I'm not leaning way forward to see. I'm leaning just a little bit. Remember that 5 to 10 degrees. That's giving me the support to look in. I would be able to see straight down into the oral cavity. But what I'm also doing is everything I am bringing over to the doctor. Thanks. Promise we'll get that tightened. So this would be, think about it, I've got my instruments here. If I bring the suction over, with the suction, a lot of times you'll see that brought over, and you can either drape it here if they're doing something. It's easy to come back and put in the holders as well, but if they don't want to hang it up, pull it out again, you can drape it. And when I'm working, I'm now, I mean, you can see the way I was. Leaning over to see, especially when I was lowered. Now, there is going to be a slight lean, but remember, we're trying to, in that, like I say, in that first 5 to 10 degrees. Now it's an easy lean, and I could easily see down into the mouth. I can easily grab an instrument to bring over. What is it doing? It's minimizing these class 5 movements for the assistant. You also have the little swing out shelf over there that'll come out from the cabinet. Puts everything in a reachable distance here. You've got the tray holder that swivels around. You've got your touchpad controls, so if you're working, it's like, hey, can you turn the light up 1 intensity? Boom, it's a quick press. You're not having to look up. The doctor's using, say if the doctor's using lighted loops, magnification, they don't want to have to look away from the oral cavity locks. Their eyes are constantly having to refocus. So the assistant can easily make these changes. One composite setting, there it is. Where the doctor might want the light turned off really quick. You're facing the touchpad, you press and hold, you're not having to twist back around, hit the touchpad and come back, turn the light back on. But just the transferring of instruments here, the vision for the assistant. And then it's just going to make it much more efficient. Easy to keep the mirror clean. You're suctioning. If you need, this is something I'm sure that's taught with assistants. It's so you don't have to hang stuff back up, droop it on your lap. They're going to be transferring instruments with their left hand from over here. So if they need an instrument, it's simply putting this in the pinky. They're going to grab the instrument. I didn't have to twist it all. What are they going to do? They're going to take that with the pinky from the doctor, boom, place the other instrument right in the doctor's hand. Put it back. Same thing. They need another one. They're going to come over, grab with the pinky, place it in the doctor's hand. It's seamless back and forth. So you've got this. If you're sitting right, I'm hip to shoulder, hip to bicep, because you're always wanting to transfer instruments under the chin. You don't want to go over the patient's face if something slips. But you can see I'm set up perfect for that. Everything's right in front of me. No twisting, turning, reaching back, leaning. This is a much more ergonomic, efficient position. I'll tell you that the assistant feels better, working more efficient. It's going to make everything better for the doctor as well. But this is really the design and why this moves around.
Tell us about this little button right here.
Yeah, so over here, just like on the other touchpad, that's if we had a cuspidor.
Okay, so this is a cuspidor, right? And then this little water.
That would be a cup fill. So if there was a cuspidor, it can have a little cup fill on
Oh, okay.
it. And everything else is the same. So over here, when you're programming a seated position, you get the chair where you want and you hit the P, and then the position you want it in.
All right, perfect. Thank you.
So we program, whether you're programming the presets from the assistant side or the doctor's side, it's doing it together because it's reading with the same circuit board. So you're not having to set it there and come back and do it over here. So over here too, when the procedure is done, the assistant can release the patient as well. With your foot control too, I'm gonna stop when this is coming out. One thing to watch with that safety plate we're talking about, you take this foot control over, the further you get it over like this, the quicker it can hit that safety plate. And all it'll do is just go down and hit it, then it's gonna pop you up to release that out. Try to keep this coming straight out of the back as much as possible. There's plenty of tubing length here where you can bring it over and turn it versus having it running over that sub base.
Now, when we are putting the chairs up for the day, what do you recommend we do? Shall we leave it in this position, or shall we have them? We usually would have them bring the chair up, put the rheostat under the chair. What do you recommend?
So is there a crew that comes in and cleans at the end of the day, weekly?
No, we have the students close everything down and they wipe everything down.
You know, for me, I don't think there's any reason to raise them all the way up. I think if you have it in this seated position here, unless you wanted to come in, you can see there's a little dust and stuff on the sub base there, but that's not gonna happen that often. I would say you just leave it in this first preset position, entry, exit. Maybe once a week, if it looks like there's dust and stuff underneath, where I'm talking about is right underneath here. Because that's really the only thing you're gonna be cleaning up. But with this, you can wipe down the chair, do all your different asepsis, and then you're not having to press. We could set a preset to be like this. I mean, I could program one of the positions in to raise it all the way up. I just don't.
That's how we normally do it. We leave them just like that.
So they're raised up, and we usually have the rheostat underneath where the gray part is, but I mean.
That's fine. I mean, if there is gonna be any sweeping and stuff, you can do that. And that's why you usually see it done that way. Private practice, you see it sometimes, sometimes not. But it's really just to get the foot control up underneath there to clean all around the chair, so you're not sweeping around the foot control. And it is simple. I mean, you just raise it up. That way you're keeping your presets on here too. So it's like 3 or 4 seconds to raise it up. And then you can coil it up underneath there, but outside of that, there's no outside reason besides that to do that.
And what was your recommendation again for cleaning? For upholstery?
Cleaning,
Just to dry it after.
yeah.
Take the chemical, wash the chemicals off at the end
Yeah,
of the
with
day.
with any wipes you use, I would just say, like we're talking about, whether it's at lunch or the end of the day, get just a wet rag, make a little dish soap, and just come and just wipe the chair down. Because that, like we were saying, that disinfectant over time, it will start, it's pretty harsh on the upholstery.
So unless we have a full chair cover, it's best that we always make sure, if we are using a disinfectant wipe for some reason, we need to make sure we wipe it off with like a water cloth to make sure that disinfectant doesn't sit on the upholstery, correct?
Correct. It's just
Okay.
getting that chemical off the material. Because most of these wipes, they do what they're supposed to do within 3 to 5 minutes. There's no reason for it to just stay on there. So it's just getting that off. It's alcohol, if it's peroxide, it's just sitting there, you know, day after day, month after month, year after year. If you can get that off, it'll make a big difference. Again, it's just, you can just wet cloth, like a wet towel. This toe board cover down here protects, you know, from shoes and stuff, and this is a consumable. It just peels off.
Yes.
So when that starts looking beat up, you just replace that. It's letting us just know when you're ordering it from your supply rep, it just say we need some toe board covers. It's the 511 chairs and seamless upholstery, form upholstery, because we have different size toe board covers for each chair. But with the covers, if you're going to be covering the whole chair, there's not much reason to disinfect it at that point. But I really would try to do, like I think you were saying, y'all do have some headrest only covers, and then the covers to cover the rest of the chair. That's going to work best, because y'all are going to start using the headrest a lot.
All right, thank you.
I do have a few questions. That silver tray, does it come off?
Yep.
So it's just a lift, okay.
So that's a tray, and it's a new design we came out with a couple of years ago. So instead of having this as all one piece like your previous ones, so they would swivel in and out, and you put a tray on it. This gives you the ability to take this out, but then you can also turn it around if you want it this way, like lengthwise. If you want it sitting more across, you can slide it back. So it just gives a little more flexibility on positioning it.
Oh, so
And
it
it's
goes
just
in the
lifting
groove.
out.
Okay.
Yeah, so it's got a little notch that settles in.
All right.
And another question I have for you, as far as the ring, that black ring you said we could do silicone on if it gets rough, is that has to be replaced after a certain amount of time? Or?
Yes, and I will send you, I'll shoot an email, but then I'll also send out a few of the laminated hard copies to keep around. It gives weekly, monthly, yearly maintenance recommendations, and it's great. It's very simple to follow. And then I can get you the part numbers for each thing that would need to be ordered.
Okay. And what is the weight limit on the chairs? Is there a weight limit?
500 pounds.
500 pounds. And does that include leaning them back and picking them up? Okay.
Yeah, with, you know, what I always recommend, if you have a really heavy patient that you're kind of worried about the weight, you really don't have to worry about it with lifting them up and down. The backrest is where you're kind of like, eh. But again, here too, taking these armrests, moving it completely out of the way, you're going to accommodate any width. I would just say, and I've seen some images of some really big people with them laid all the way back, but if you don't feel comfortable with doing that, you can raise them up and down easily. Maybe sometimes just don't take the chair back all the way back. The chair itself is a very heavy chair from the base. This down here weighs right around 150 pounds. It's a cast iron sub base, so it's got a heavy, sturdy foundation. So you're not worrying about the chair like wobbling or tipping over. But yeah, I would say maybe if you get up to where it's a weight that you're kind of worried about leaning the chair all the way back, that'd probably be the thing to do.
Okay. As far as running solutions through the lines when we have to clean daily, what is your recommendation for the line cleaning?
There should be, I don't know what vacuum line cleaner.
We use
There's-
Slug Bug is what it's called.
Okay. So our vacuums aren't here. We just always recommend a non-foaming, but with suctioning the lines, in a standard general practice, we recommend doing it daily at the end of each day. If there's a surgical case, we recommend doing it right after a surgical case, but once a day.
And there's another question before I forget. Where do you change the traps on these chairs, and what kind of traps are they?
Can you pause real quick?
Yes.
Let me go to the restroom real quick.